Okay, the next is tremors, essential tremors. You're halfway to in surgery, GP surgery. You've got a young patient and complains of tremors in his hands. Right. Again, tremors, there can be lots of reason behind it. Or sometime when we say essential tremors, which means there is no reason behind it. It just happened. Why? Because of stress, maybe. So there is no reason behind it. Easy stations to manage, but we definitely want to see if you are ruling out some secondary causes or not. And that's really important. Yeah. How can I help you? Uh, I have tremors. My hands are shaking. Then what I'm gonna do? I'm gonna do my elaboration. I'm gonna do my OD para. Right? I'm gonna elaborate it. So tell me more about this shaking. For how long you've been having it? Is it all the time? If it comes and goes, is it like at rest? Is it like when you do some work? Is it only then? Are you able to do your daily routine things properly or not? Anything makes it worse? Anything makes it better? And yeah, all those questions, you can ask. Yeah. Fine. Now, what else you can do is you can try ruling out some differentials as well. You can try ruling out some differentials as well. For example, the tremors, you will see it's there if you have got thyroid. It's there if you are having any drugs. If you're taking any drugs, it can be there as well. Parkinson as well, but I would say less likely. My patient is quite young, isn't it? My patient is 27. So that's a tricky part here. But yeah, okay. So I'll do Odipara when it gets worse, when it is getting better, right? It's happening for a while now, but it seems to get worse at times. Okay. And then what I'm going to do, I will try ruling out some differentials as well. If the patient is a diagnosed case of anything like any diabetes, any thyroid problem mainly, right? And why I'm asking about this weakness, unsteadiness, dizziness because of some secondary problem, right? So maybe MS and all, multiple sclerosis and all, fall and all, you can ask those things as well. Trouble in walking, eye problem, you can ask as well because of thyroid, because of MS as well. Okay. How's your mood? You're leaving, stressful, quick, past personal history as well. I would like to do general physical vitals and neurological examination, blood test, UNE, liver kidney function test as well. When you're doing the lifestyle history, do not miss this smoking, alcohol, caffeine, all those things. That is really, really important because caffeine is the reason maybe that's making it worse, right? From our assessment, we suspect you have got essential tremor, which is a condition that causes a shaking in the hands and sometimes the other parts of the body. It's fairly common condition that runs in the family. And I understand you mentioned no one in your family has had it before. This type of tremor is not caused by any other illness and often improves with medication. That's the main thing, right? So, essential tremors, nothing to worry, but what you need to do, you need to make sure you rule out the secondary causes if there are any reason behind it. That's the main thing. Treatment is lifestyle only, so just need to work on the trigger factors. So, mainly the patient will tell you the trigger factor is mainly the stress. So, stress management, yoga, meditation. And there is caffeine sometime, or sometimes the patient might take, I'm taking certain medications. That could be the reason as well. Okay. Then medications can be given as well. Usually the beta blocker, propranolol, that can be given as well, right? I mean, I think you must have seen, for example, when you are stressed and you're doing the mannequin, you're doing blood sampling, you're doing a cannulation. So what happened is we started having the tremors while doing it, right? So do you have any secondary causes? Not really, but it happens. Why? Because of stress. So that is what we call as essential tremors. So the simply thing, the tremor that we can get it while doing a cannulation or blood sampling in a mannequin, for example, that is your essential tremor. There's no reason behind it, but why it is there? Because of stress, right? But some people you'll see it can get worse with the tea coffee as well, or maybe they're under, they're taking certain medications as well. That's why a lot of people ask me, can I take beta blocker? Can I take propranolol when I'm going to go for my exam? My answer would be don't try anything which you have not tried before. Don't try anything just before the exam because it can make you slow as well. So be careful about these things, right? Physical therapies, like some patients find that physical therapy can help to control these things. Surgical options, but that's rare. You don't need to go into that. much. Patient might ask, is it Parkinson's? You know the answer, it's not. And we don't expect a patient to have Parkinson's at this young age as well, 27, isn't it? And if you are thinking about Parkinson's, just make sure you rule out, you can ask questions for Parkinson as well. So in Parkinson, three things that you need to know is they have resting tremors, pin rolling. That's one. Number two is that they have got muscle rigidity. And third thing they'll have is bradykinesia. Right? So you can ask these questions in the history, but less likely it is Parkinson's. While patient is 27. All right. So that's what you have got in essential tremors. Essential tremors, there is no reason behind it. You just get some tremors while doing something. It's because of mainly stress or maybe alcohol, maybe tea, coffee. But yeah, we need to try making sure that we are finding it out if there are any secondary causes like thyroid, diabetes, or Parkinson, or MS, or any drug if patient is taking. So just try finding these things out. All right. So that's what we have got in essential.